Hi, I'm Dr. Steve Meyers, and I'm here with my patient, Dr. Cepeda, who is 7 months out from a combined regenerative procedure using stem cells from his own fat tissue along with PRP into bone for bone issues. He's about 7 months out from procedure. Before we talk to him, we're going to take a quick look at his imaging studies. Okay, so taking a look at his X-rays, this is a standing AP looking at both of his knees. This is his left knee. This is the more symptomatic right knee. He has good joint space on the outside of the right knee, but notable loss of joint space on the inside of the knee, indicating arthritis on the inside of his right knee. Switching to his MRI, he's got this area of notable change going on in his tibia. He also has some bright change going on in the femur. These areas of bright change are swelling in the bone, inflammation of the bone, weakening within the bone, indicating arthritic change occurring inside the bone itself. And when you have these bright changes on MRI, these areas of bright change can be a notable generator of pain. To treat these areas of pain coming from the bone, it's not enough to simply inject into the joint. You have to inject into the bone directly. What that looks like is taking a needle and injecting into the bone, into the femur here, and also into his tibia with concentrated platelets from his blood, which release growth factors which stimulate a healing response inside the bone. All right, so take me back to before treatment. Describe your issues. What kind of symptoms were you having with your knees?
I was having trouble with my right knee. I had problems with being able to walk, being able to exercise, being able to do anything without sharp pain in that right medial knee. And it was like about 6 to 8 months of that.
How severe was the pain?
On a scale of 1 to 10, it was like about 8 or 9.
So as a physician, as you know, stem cell is still not the mainstream treatment for knee arthritis. How did you come to the decision of going through stem cell and regenerative treatment for your knee issue?
So I'm an OB/GYN physician, obstetrician, and we were collecting cord blood samples all the time, and cord blood specifically for stem cells to be used on babies and young adults if they needed it after birth, like for cancers or leukemias. And so I did a lot of reading on stem cells and saw about mesenchymal stem cells and how they were used on new research involving heart attacks and repairing heart tissue and brain. It's a connective tissue kind of repair, and I thought, it's got to work on joints, it's got to work in cartilage. So that's when I started pursuing that avenue for treatment.
Here we are 7 months out from procedure.
Mm-hmm.
How are you doing now?
I'm walking, I'm exercising, I'm not in pain in my knee. I went through 8 months of just, a lot of real agony, just limping and trying to wear, off-brand braces on my knee, and none of that. I don't need any of that right now.
How quickly after treatment did you start seeing some improvement?
I think that first month I started noticing some, resolution of the pain, but I really wasn't going to hang all my eggs on that basket. I wanted to wait and see what was going to happen. So I just took it easy. And probably by the second month, the pain was starting to go away.
So here we are 7 months out. What do you say, you're 10%, 50%, 80, 90% better? Put a number on it.
I'd say I'm going to just say 90%.
Are there activities that you can do now that you couldn't do before?
Walking. I do 3, 4, or 5 miles walking now. Riding my bike without any effort or any difficulty. I haven't started running, but I'd like to. I'm kind of leery, but because that's what got me into it.
So having been through it, do you feel like you made the right decision for your treatment?
Absolutely the right decision. I mean, I have a lot of my friends who've had the knee surgeries, and I couldn't get myself to that, knowing the data and the research that I had read about stem cells, and I said, this has got to work. I mean, if we're using it and it's working in other areas, it's got to work on my knees.
Well, thanks so much for sharing your experience.
You're welcome. Thank you.